Hi everyone, this is Dr. Karamachi. I wanted to talk about nurses and what they're facing lately. So this is more towards healthcare workers. If you're not, it's up to you. So there has been a lot of stress over the last 3 months or so because of COVID-19 and everything else that is happening. Initially, we had issues with not having access to the masks and other protective equipment. Initially, there was a lot of uncertainty about how many patients we'll get. There was talk about surge and different healthcare systems getting overwhelmed, like in New York City and California and other places. That hasn't happened. There was not a situation where this particular hospital that I work in, there was never a situation where they were overwhelmed. We didn't have like more than two patients in the ICU at any time, as far as I know. I may be wrong with the numbers. And we did have a few deaths, but overall, things went okay over the last few months. Recently, a survey came out for the nurses. This was done in, I think, UK. They used different technology platforms to do a survey, and they noticed at least 50% of them, the nurses wanted to quit, and I think vast majority of them not only wanted to quit, but they wanted to go to a different line of work. They felt that nursing is not for them anymore, and this is really unfortunate if this is a true reflection of what is happening. I'm hoping that even if it is true, it is transient and things will go back to normal in the next 6 months. I believe a lot of it has to do with the way the crisis was handled, the way they were supported, or the amount of resources they had, and also it has to do with self-care, because a lot of us, just like general public, we were also under a lot of stress. People were watching the news, and there was a lot of bad news coming out every day. So chronic stress can lead to despair, feelings of hopelessness. Essentially, these are all called burnout in healthcare. So I can see how this can come out as signs of burnout. And so I want to focus on some solutions to the problem. Obviously, if you're in a healthcare system that is not supporting you, then probably you may have to quit and find some other job. But a lot of us can't find jobs where we live. Some areas there's just one hospital system that owns everything. So if you're not able to move, or if you're not able to find a good job, then you have to figure out how you can do nursing and still be able to take care of yourself. And a big part of that is, I'm a big advocate of lifestyle, doing regular meditation, taking care of stress every day. If you're deficient in some vitamins, taking a lot of vitamins, doing yoga sessions on a regular basis. So if you're interested, comment below. I'll schedule some more yoga sessions. Um, I'm trying to experiment with different technologies to see how I can do this. I've used Zoom before. Maybe I'll use Facebook next time again. So that's something I'm willing to offer. See if that's going to help. And also working on nutrition. A lot of us, if you're busy at work, you're not getting enough nutrition. You may be eating junk food, and that contributes to feeling of tiredness and getting sick at home and so forth. There's a lot of burnout in healthcare, not only doctors, nurses, but in other, like, technicians and so forth. And hopefully the administrators or the decision makers will change some of the things that are happening. We have on one side, because of liability, we have to document so much. We have to document everything that we talk about with the clients. We have to do a lot of things on the computer. It ends up with a situation where you're doing more stuff on the computer rather than bedside, where actually you're doing the care on a day-to-day basis, where you're actually touching the client and doing stuff with the client. And that's not happening, and that's unfortunate. Hopefully we'll have a smarter system in the next 5 to 10 years where you'll be spending less time on the computer and spending more time bedside. And hopefully this COVID-19 crisis will bring a national awakening, and things will change for the better. But meanwhile, we have to keep working, and we have to use a lot of self-discipline, and we have to work on our lifestyles to prevent burnout happening to us. So those are my thoughts. I want to quickly share them with you. Um, although if you're not a healthcare worker, this also influences your care. When you come into the hospital or when you're in the clinic, your care may be compromised. If somebody is burnt out and they're not, they're completely stressed out. So this will become apparent in the system where you'll see more mortality and more morbidity. So I wish you all good luck. I'm available as always. Send me a DM if you want to have a private conversation. If you feel free to comment below. Feel free to share my video. And I look forward to talking to you again tomorrow. Bye.